Hello, welcome everyone. I am Dr. Jennifer Hux. I just wanted to take a brief moment of your time to discuss a little bit about what is naturopathy. So, a lot of people want to go more of a natural route when it comes to medicine, but they don't know where to start. And so, I urge you to reach out to a naturopathic physician. They are trained highly in many different modalities, including the basic sciences. So you're going to get that basic understanding of the science principles and how the body works, the anatomy, the physiology, the chemistry aspect of everything. And then instead of focusing more on the pharmaceutical aspect of treatment, we would focus more on different natural modalities as a baseline to start with. So in naturopathic medicine, we use what's called the therapeutic order. So we would like to address the root cause of the problem and focus on balancing those basic determinants of health before jumping into a pharmaceutical or a higher force intervention. So I'm just going to go over a little bit about the therapeutic order. So the therapeutic order does start with those basic determinants of health. And when we think about those, we think about nutrition, hydration, sleep, work, exercise. Having that good balance with all of those basics in our life is going to promote health within the body. So we want to establish this foundation for optimal health, and then that's really going to help us to remove the obstacles that are throwing your body out of balance. So let's say you're someone that is working incredibly hard and you eat really well and you exercise constantly, but you're not sleeping. Well, if you're not sleeping, then your body's not able to rest, rejuvenate overnight. So we may want to start from that standpoint. How do we improve your sleep? How do we get it to the point where you are actually able to be your best every single day? So a lot of naturopaths start with this nutrition, the hydration, the sleep, all very important because our whole body, and able for it to run its normal physiological processing, requires these nutrients, this hydration, and also this moments of rest. So when we start there, we can really remove a lot of these obstacles to cure, so that way our path towards health is a much clearer path without something else gumming up the works. So that's the baseline. That's the bottom of our pyramid. And then when you move on up the line, you look more at stimulating the body to heal itself. So when you look at the way that a naturopath is going to practice, we're going to want to stimulate your body to heal itself because the body has an innate ability to heal. That's called stimulating the V's medicatrix naturae. So that's your innate ability within your body to fix what's wrong. So when we stimulate the body to heal itself, then we get a much better, faster response. So some things that we can do to help stimulate the body may be acupuncture, massage, it could be chiropractic work, anything that's going to really help to boost your body and your essence. So a lot of people will use things like homeopathy. That's an energy form of medicine that can help to promote your constitutional essence. So that's the next step. So once we've established that baseline for your health, then we want to stimulate your body to heal itself. After we've done that, we can move up the line in the therapeutic order depending on what's needed for each particular patient. So the next step is going to be to support and restore the organ systems that have either been damaged or weakened over time. So most of us know with a lifelong of assault to our body, we can have some organ systems that are engaged that are weakened from what we've done to them over the years, especially the liver. We see this a lot with liver, lungs, kidneys, things like that. So then that's when we get into a little bit more of some of the supplements and some of the aspect of medicinal foods, because we want to support your body's organ functions, not only so that your body can heal itself, but also because it may need a little bit of a boost. So let's say, for example, you're dealing with fatty liver disease. So if you have fatty liver disease, then your liver is extremely backed up and it's not doing so well with conjugation and getting your body to metabolize the ingredients that we're putting inside of it. So it's not able to take those initial ingredients, turn them into water soluble active components, and then eliminate what we don't need from the body. So it backs up. Whenever that backs up, then we see this cascade of other problems. So what may look to be like a chronic disease that's liver backup could just be that there's basic determinants out of health. We haven't stimulated the body to heal itself, and we haven't supported that organ system that's doing all the work for us. So that's that next step. So that next step is to then look closer at which organ systems are engaged and which ones need to actually be supported. So let's say, for example, you have a chronic cough. Well, if you have a chronic cough, then are the lungs dealing with this rundown effect where they're not optimal right now in their functioning? So do we need to support that lung function as well? A lot of times what people will do is they will suggest other natural treatments, even steam inhalation. Sometimes we use small amounts of essential oils within the steam, or even things like N-acetylcysteine, which helps with pulmonary function. So we would want to address how can we optimize the function of every single organ that is going through it right now. So that's the next step. And then when we move further up the hierarchy, we're going to look at that physical alignment, because the physical alignment has so much to do with our body. So before, when I mentioned that chiropractic work can stimulate the V's, stimulate the body's innate ability to heal, that is a two-part thing. So not only can chiropractic stimulate the body to heal itself, chiropractic will also help to restore alignment. So when we get these adjustments, we can help with not only the alignment, but also nervous system functioning. Because when things are out of alignment, we actually have the nervous system gets into a little bit of a hiccup from that. So as we move up this line and we start looking at, okay, we fix the basics. Okay, the body's gonna actually start kicking up to heal itself. Okay, we've supported these organs and given them everything that they need to function properly. Okay, what else is out of whack? Okay, well, maybe you have bones out of place, or you've got muscular hypertonicity on one side of the body. So when we look at that too, massage is a wonderful way to address that physical alignment. Yoga is a wonderful way to address physical alignment. So when you have something that's out of whack or imbalanced in the body, even the muscles or the bones, we want to put that back in place. And that's that next step. So before we even address any form of medicine, we're looking at how to help the body heal itself, and we're moving up the line from there. So for example, let's say you have incredibly tight glute muscles. Well, if you have incredibly tight glute muscles, especially, the piriformis back there, what it can do is, imagine that this is your hips, and if it's really tight in the back, well, that kind of pulls back, right? So then we end up with an external rotation of the legs, and that's when you see the people that stand like this all the time. So they have typically really tight glutes, or piriformis syndrome, or something like that. So what we want to do is we want to then work these muscles back here so that the hips can stay in alignment, so that the body can stay in alignment. If this becomes incredibly tight in the back, then once again, we externally rotate. This will then throw off our gait pattern. This will then affect the whole kinetic chain from the feet up to the hips, and even sometimes further higher. So you really want to make sure that there's not any muscular imbalances or bone imbalances that are throwing the body out of whack, causing a further problem as we move forward. And then and only then is when it comes to natural supplement treatment options to address symptomology. So we don't address symptomology first, we address the root cause of the problem. when we've addressed the root cause of the problem, then for compliance aspect and helping to actually take our patient out of pain and out of discomfort, we would then address what is more known as green allopathy. So a lot of people call it green allopathy, and that's just where we're treating symptoms with natural substances. So that's that next line up. So if we've done everything else, we've corrected the determinants of health, we've done everything we can to support the organs, we've corrected alignment, then maybe we do need something else to address the symptoms because the patient's miserable still. So if they're still miserable, then we address that. So here is where they would maybe address something like an herbal supplement that is an antimicrobial or an antiviral herbal supplement, or maybe prunus, which is wild cherry bark that would address a cough or something like that. So we can address the symptomology with natural options as well. As things become more severe and as disease tends to progress, then it may reach a time and place where we need more of a synthetic option, time and place for pharmaceuticals. So then as we move up that line, then we get to the point where we're looking at those pharmaceutical options. So let's say you've got uncontrolled blood pressure. We've tried to address the body. We've tried to address the vascular health. We've tried to address your hydration, foods that you need to be eating to support your vessels. We've tried to address everything that you can do to lower your blood pressure from a behavioral standpoint as well as an environmental standpoint. And let's say we're just not there yet, or we need some additional help in the meantime while we're still working on all of those other goals, because your health is still number one. And it's still number one to do no harm and to do what's best for your patient at that time. So if they're in hypertensive crisis, or if they have really high uncontrolled blood pressure and we don't want to put their kidneys, their eyes at risk, put them at risk for a stroke, we may need to use a synthetic pharmaceutical medication in the meantime while we're still working on everything else to promote that balance and control within the system. So that might be where a lisinopril or something like that comes into play for a short period of time so that we can address everything while still doing what's best for our patient and making sure that they're not being put at risk in the meantime. And then, of course, if things are worse or things become more severe, or even with traumas and motor vehicle accidents and serious injuries, then we get into more of the high force interventions. What's most important is making sure that this patient is safe and that their vitals are good and that they are able to carry on another day. So that's where some of the extreme high force interventions come into play. So surgeries, emergency like bypass, anything that you can think of where it involves pretty much the emergency room, that's going to be more of a high force intervention. So there's this therapeutic order that you start with the basics, you figure out what's out of balance, and then you work your way up from there. And that's what naturopathic medicine is. It's not just you go into the doctor, you tell them what symptoms you have, and they hand you a prescription. If you are looking for that, you are not going to enjoy your naturopathic appointment, because a naturopath is going to put some of this responsibility back in your hands. So we want you to be on this health journey with us. And we understand it is a health journey. It is not a cure-all, fix-all, magic pill option. And even if we do have what you would consider a magic pill, there are so many other things that are going to play into the full picture that you still have to work on that balance for yourself. So even if you do find a medication that you're like, oh, this is the best ever, that's, it's fixed all of my problems, it's fixed the symptoms. And there are many other things that we have to do on a daily basis to promote balance within our bodies to actually be healthy. And so I urge you to find a naturopath if you're interested in taking this whole health approach. If you are interested in really looking at how to prevent disease, how to avoid suffering with these chronic illnesses, because if we don't address the basics, then we're just suppressing symptoms. and suppressed symptoms will turn into bigger problems. So address the root cause, fix the basic determinants of health, stimulate the body to heal itself, work on correcting any, organ systems that aren't optimally functioning, really support the body, correct any misalignment in the body, correct muscular imbalances, work on potential natural symptomatic relief if need be, and then move on from there. If you need a pharmaceutical, there's a time and a place for everything. And I'm not against that in any way. But if you're not addressing any of the basics and you're jumping right to that point, you are setting yourself up for chronic illness. So if this sounds like something that you want a doctor to take a look at for you, you want a physician that's actually going to look at all aspects of your health and start from the ground up, remove your obstacles to cure, and then move forward, that's what I would suggest for you, is to go find a naturopath. If you want to find me, Dr. Hawks, DocHawks.com. Please feel free to reach out. You can email me, call me, text me. No worries. We'll set something up that works for you. And just remember, this is your health journey. So if you want to do a little bit of extra work to be 100 times better, I'm here for you. If you're interested in just finding a magic pill, there are plenty of other specialists for that as well. I hope you have a wonderful day, and I'll talk to you soon.